Welcome to this topic. My name is Dr. Achievement, and today I'm taking on shoulder joints, shoulder complex. Alright, we'll start from introduction to shoulder joints. We know shoulder joints is a joint in our shoulder, on our hand, the upper joints close to the neck. Alright, so the shoulder joints, something you don't know, there is lots of joints functioning at a time. In the shoulder joint, the shoulder complex is quite big. It's composed of the scapula, the clavicle, the humerus, and is designed in combination of three joints that links the upper extremities to the thorax. Alright, the shoulder joint is composed of three synovial joints. Alright, and in addition to another functional joint which is called the scapulothoracic at the posterior side. And what are these three synovial joints? We have the Sterno-clavicular joint, we have the acromioclavicular joint, and we have the glenohumeral joints in the shoulder joint. Alright, so today I will be focusing mainly on the Sterno-clavicular joint, and in the next topic I will cover other joints. Alright, so sternoclavicular joints serves as the only structural attachment of the shoulder complex and upper extremity to the axial skeleton. Alright, what is the type of these joints? Sternoclavicular joint is a plain synovial joint. Alright, we have different types of joints. We have synovial joints. Alright, so in this case we are saying it's a plain synovial joint. Alright, so degrees of freedom, it has three rotatory and three translatory. Articular surface, medial end of the clavicle is articulating with the manubrium of the sternum and the first costal cartilage. Alright, so that is for the sternoclavicular joint, and we'll see what are the ligaments there, because in that joint, if there is a joint and you don't talk about the ligament, you don't talk about how it moves, the mobility, then you have not talked most about the joint. So we're going to talk about what ligaments are there. There are three ligaments in the sternoclavicular joint. We have the sternoclavicular ligament, anterior and posterior. We have the costoclavicular ligament, and we have the interclavicular ligament. Alright, so you can see the picture in the slide right now. It's showing the sternoclavicular joint, and you can see the interclavicular ligament at the middle upper side of the sternoclavicular joint. You can see the anterior sternoclavicular ligament. You can see the costoclavicular ligament and sternoclavicular joint capsule and anterior ligament. You can see the picture right now. Alright, so this is the sternoclavicular joint. It's a joint at the front. It is positioned at anterior of the body, above the rib cage. Alright, there is a bone called the clavicle that runs past the first along the first rib area. It runs is superior to the first ribs. Right, it runs to attach to the scapula. Right, and you can see sternoclavicular motions. What are the motions that can occur in this joint? Most of us will think there is no motions there, but there actually is some motion, some movement occurring at this point in the joint. Alright, you have the three rotatory degree of freedom. Elevation, the elevation goes to 48 to 50 degree, or depression goes to 15 degree. The protraction, 15 to 20 degree. The retraction goes less than 30 degree. We have the anterior 10 degree and posterior rotation, which is 50 degree. Okay, you can see the degree is quite huge a little bit in this joint. We have the 3 degree of translatory motion, anterior or posterior, superior or inferior, and we have the medial or lateral. So that is it, guys, for sternoclavicular joints. Alright, in the next topic I'll be talking about the other joints. Acromioclavicular joint is there. We'll be talking about the ST joints, the scapulothoracic joints, and we'll as well be talking about the glenohumeral joints. So that is it for today, guys. Have a very nice day.